Here's something you may have missed on Michiana's Morning News.
Thanks for having me on.
Good morning. Let's talk first about the effort to get money passed to fight the effects of the virus. Now, yesterday, Congress approved a $100 billion plus bill. What is that money being used for?
Yeah, so we've already sent out $8.3 billion, first vaccines, tests, potential treatments, and help for state and local government. So we wanted to make sure that we had some immediate money out the door to deal with near-term healthcare needs, as we're hearing from the healthcare and state and local authorities. The bill yesterday will add to that. It'll be emergency food aid, free testing for these kits that are coming out, some of which are being made in the state of Indiana through FDA guidance. And lastly, emergency unemployment insurance. It's essential that everyone's at ease if they've been furloughed or let off or unfortunately their company has gone under, that every family is going to be taken care of during this difficult time. So we're putting together yet another package, which I can speak to, but a very high vote over in the Senate. So we all came together for the good of the country, and we saw the same thing in the House. So fortunately, it appears everyone's poised to do whatever they can to come to terms and provide Americans whatever they need during this difficult time.
All right. Well, in addition to that, federal officials are focusing on the Trump administration's $1 trillion plan to stabilize a national economy reeling from the impact of the virus. Now, what is that money being used for?
Yeah, so that money is going to provide an infusion of capital, real cash, so that businesses can have a bridge between this time when people aren't buying things. Airlines, I flew in a plane from Indianapolis to D.C. On Monday morning. I was the only person. More importantly, or as importantly, our small businesses. Our restaurants have effectively been shut down. So many small businesses operate with very little cash on hand. We need to provide the liquidity for otherwise viable business enterprises led by people who didn't make the wrong decisions and staffed by workers who the day before had great jobs before we learned of this pandemic. So we're going to help the workers while they're home, and we're going to help the businesses with sufficient liquidity so that on the back end of this, hopefully in a couple of months, we'll have places for people to go back to work.
Once again, we are speaking with U.S. Senator Todd Young of Indiana. And Senator, we're on day 3 into the president's 15-day recommendation to stay at home and avoid crowds over 10 and limit travel to necessary travel like work only. What do you say to the people who are not yet heeding that advice?
Yeah, I would say, the president's advice is grounded in the science and the judgment of public health authorities. And I know it's a hassle. I know it's inconvenient. I know from conversations with some of my children that it can be boring. And it's just completely disrupting our way of life, to put it mildly. But people can indeed pose a risk to their neighbors if they mix together in groups. I think the latest number was groups larger than 10. Mm-hmm. There may be some update to that number and the sorts of direction we get from public health guidance in the next couple of days. But please follow public health guidance because otherwise you could be a community spreader, I guess is the term. You could, unbeknownst to yourself, be a great person and a neighborly person and end up coming into contact with somebody who has the virus, obtain the virus yourself, and then pass it on to others. And that's how this thing spreads throughout the country, throughout the world, and leads to people getting very ill and sometimes passing.
Well, that just leads me to my next question then. Citywide lockdowns. Do you think we can expect more talk about this as the virus spreads, and can it happen here?
Well, it's already happened here in New York, that city of New Rochelle, that the governor essentially ordered a lockdown in. So we've seen it in little fits and starts, bits and pieces, but we haven't had sort of a national level lockdown. And, I'm not prepared to say that is coming. What the president and his public health authorities working directly with the governor and local authorities and all of our other stakeholders, from private business to our not-for-profits and volunteers. What we're all trying to do collectively through a whole of America effort is avoid having to do that. But I'll tell you, if that's the most responsible thing, that will lead to a lot more deaths and a lot less economic damage, then I know we'll all come together as a country, and we'll get through this. We will persevere.
All right, Senator Young, is there anything else that we haven't asked you that you think our audience needs to know?
Well, I would just really emphasize, I know there's a lot of confusing information out there. Sometimes I get confused and feel like I hear contradictory information from one seeming subject matter expert or one media personality to another. And so as we learn more information about this, we tend to consult in our office with the Centers for Disease Control, and that's the information I rely upon when I'm trying to cite authoritative sources and communicate with people. So our website is consistently updated. We're open for business. We're fighting for Hoosiers. We're fighting for individuals. But if people want more information, please go to our website and put it on your bookmark. And we also send out email updates. My website address is Young, that's YOUNG,
.senate.gov. Michiana's Morning News, weekdays from 5 to 9 on 95.3 Michiana's News Channel.
Podcasts by Federated Media. Podcasts by Federated Media.